Today we are going to discuss about the call for social workers and psychologists for enrollment under National Commission for Allied and Healthcare Professionals portal. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about an important enrollment portal. This enrollment portal will be calling for registration of various allied and healthcare professionals. This enrollment portal is formed under the National Commission for Allied and Healthcare Professional Act 2021. Why should we register? How to register? What are the benefits of registering? What are the relevant provisions under the Act? And if I have any problem, how to resolve it will be discussed in this video. This Allied and Healthcare Professionals Enrollment Portal was launched on 29th October 2024 by our Honorable Prime Minister Shri Narendra Modi ji. This is an important landmark step taken by the Government of India. As you know, on 28th March 2021, the National Commission for Allied and Healthcare Professional Act 2021 received assent from the President. This has 8 chapters, 70 sections, and an important schedule which will discuss who are these allied and healthcare professional and how they register, what are the courses, how these institutions will also be registered. If you look at the section 13, it talks about the central government need to form a central register. This register will enroll all allied and healthcare professionals. This is a live, online, central registry. Whoever gets registered, this document is considered as a public document, and the people who are enrolled will be listed in this register. Further, what is the privilege of getting enrolled here? Here you need to understand, once you get enrolled here, as per this legislation, you'll be able to provide services, you can charge for the services, and also the fees that needs to be paid for you. Further, you have certain rights. What are those rights? The rights are holding an office under Allied and Healthcare Professional Act, either in the government or any other institution, to provide services for the clients or the patients. And also, this legislation entitles to sign certain legal documents such as medical certificates and other certificates if you have provided services to them. It can be insurance, it can be hospital bills, or else if you are issuing a bill for providing services. Further, here a person who has qualified and is able to register under the central register, or it can be under the state register. If the state has their own council, they will register, and later that will be updated with the central register. But this portal, which I am going to discuss, is from the central government. You can directly register under the central register. Once you register under the central registry, the central government will issue a certificate of registration that is under section 17. So my dear friends, you are able to register yourself and you will be getting a certificate under this legislation. Further, the rules were also notified in 2021. The Government of India notified on 25th May 2021 the rules, and also the act was implemented. If you look at the rules, again, the rule number 12 clearly says under Form B, you need to apply to get registered under the central registry. Here, the Form B is very clear, and you need to pay 2,000 rupees as per the rules. But at this point of time, it is free. Under the central portal. Further, you'll also get the registration certificate under the Form C. Now, this legislation also has given a timeline for formation of state councils, so that many people who are allied and healthcare professional want to register under the state can also be registered. That means within 42 months, they need to form this council across the country. So, under this legislation, 56 allied and healthcare professionals were considered. Recently, one more profession was added, that is acupuncture. So, my dear friends, this legislation is a landmark legislation with regard to provision of services across the country. And also, this legislation also aims to bring our medical profession, allied and healthcare professional to the international standard. Now let's look into the schedule. This is the schedule which is there in the end of the legislation. This schedule has 4 important categories. First one is serial number. The second one is recognized category. What is the category of the allied and healthcare professional? Further, under serial number 7, which is essential for mental health and psychiatry. Here, it has been divided into 2. One is community care, behavioral health science, and other professionals. The first one is community care. The second one is behavioral health science professional. Further, if you look at the professionals which are considered, they are in the 3rd column. And finally, there is something called as ISCO code. ISCO means International Standardized Classification of Occupation. That means this legislation tries to bring allied and healthcare professional to the international standards and comparison purpose. If you look at the behavioral health science professional, let's understand this, how they have been defined and what are those professionals come under this. Let's zoom it. If you look at the behavioral health science professional, how they are defined? It is defined as those persons who undertake scientific study of emotions, behaviors, and biology relating to persons' mental well-being, their ability to function in everyday life, and their concept of self. This is how they have defined it. But they have taken an important positive step. They have renamed mental health into behavioral health. That means this legislation considers mental health as a stigmatizing word, the word mental, and they have renamed it as a behavioral health. So this can be considered as a destigmatizing, moving one step forward and considering as a behavioral health, in line with the international standards. Further, who are the professionals? The professionals are counselors, analysts, psychologists, educators, and support workers who provide counseling, therapy, mediation services to the individuals, family groups, and communities in response to social and personal difficulties. So this is how behavioral health science professionals have been defined. Let's look into each one of them. If you look at the first one, they are considered as psychologists. They come under Ministry of Health and Family Welfare. However, the clinical psychologists are registered under Rehabilitation Council of India, under Ministry of Social Justice and Empowerment. Further, the behavioral analyst is considered integrated behavioral health counselors, health educators and counselors including disease counselors, diabetes educators, lactation consultants. Further, social workers, clinical social workers, psychiatric social workers, and medical social workers. Further, HIV counselors or family planning counselors. And finally, mental health support workers. However, this legislation talks about removing mental word, but further they have continued to keep mental health support workers. Wish it was changed as a behavioral health support workers. Anyhow, this is a discussion by the policymakers and they have taken the decision. Further, other healthcare professionals. If you look at the other healthcare professionals, podiatrist, palliative care professionals, those people who are working with patients who have cancer or the patients who have the end of life care, people who are working, they can be considered as palliative care professionals. And another important decision was taken, that is movement therapist, art, dance, that is basically recreational therapist and movement therapist were added here. So these are the professionals who come under serial number 7 for behavioral health science professionals. Now let's look into how to do the enrollment. If you qualify for any of this post-graduation under Allied and Healthcare Professional Act and the scheme, then you are eligible for enrollment. Now let's look into the enrollment. Enrollment occurs in 3 simple, easy steps. First one is you need to generate Allied and Healthcare Professional Enrollment ID. First, you need to generate an ID. Once the ID is generated, you need to fill the form by giving various information and finally submitting the form. So these are the 3 important steps you need to understand. Let's now go into the registration. Please scan the QR code. This QR code will take you to Allied and Healthcare Professional Enrollment Portal, which is formed by the Government of India. Please remember, there are at least 5 to 6 different various other websites which are societies, not the government agencies. They are also registering for their association, but this is specifically under Ayushman Bharat Health. So you need to register under the Allied and Healthcare Professional Act portal. So use this QR code. This is how the portal looks. Allied and Healthcare Professional Enrollment Portal. Clearly, you can see the logo of India and also National Commission for Allied and Healthcare Professional logo is also there. Once you enter into this portal, click for the login. Once you click for the login, you have 2 options. One is already you are an existing user or else a new user. Invariably, first time you are logging in, so you'll be clicking the new user. Once you click the new user, there is an instruction given. Please read this instruction because you need to prepare certain documents before you move forward. What does that instruction gives? The instruction tells to keep the Aadhaar card, Aadhaar registered mobile number, 10th marks card, 12th marks card, degree or diploma certificates, internship certificate and experience certificates. These certificates should be in the digital format. The digital format can be PDF, JPG or JPEG or even PNG format can be considered. But the document should not exceed 5 MB. So I'll repeat. Have a digital copy of Aadhaar card. Have a Aadhaar registered mobile number with you. 10th and 12th marks card. Degree certificate, both degree and post-graduation, internship certificate and experience certificate. Now you can ask, sir, I have passed around 10 years back. At that time, there was no internship. In that time, you need to say internship certificate is not applicable, but you will provide the certificate of experience. Where you are working, what are you working, those working place certificate, that experience certificate from the institution, organization, wherever you are working, those needs to be uploaded. So, and these documents should be either in the PDF, JPG, JPEG or PNG format. So now let's start the enrollment. You have kept all this ready. Now you are going to put your Aadhaar number and then you are going to generate Aadhaar OTP. Once you enter the OTP along with the registered mobile number, you have now enrolled, my dear friends. Here, it will also give you an option to form the ID. That ID, Allied Healthcare Professional Username, unique name can be formed. That once you give if it is available, it will be taken. Then you have various other important like allied healthcare professionals and which category you are registering, giving the new passport, mobile number, date of birth. Those which are there already in the Aadhaar will be taken and uploaded here. So many a time you need not worry about those things. But please remember, these allied healthcare professional, which category you are going to choose has to be very clear, and it should match with your degree, post graduation, and also the experience you are working. And later it will be very difficult to change. So please remember this. These two rows are very essential: allied healthcare professional and allied healthcare professional category. Now let's look into this. As I said, the third column belongs to the various behavioral health science professional. So let's move into the first one, allied healthcare professional, that is psychologist except clinical psychology. So there you will automatically, the category will be chosen is community care behavioral health science and other professionals. The second one, if you choose behavioral analyst, again community care behavioral health science and other professionals will be chosen by default. Integrated behavioral health counselor, again the same community care behavioral health science and other professional will be chosen. If you choose health educator counselors, including disease counselor, diabetes educators, again the same community care behavioral health science and other professional will be chosen. And for even social workers, including psychiatric social worker, clinical social worker, and medical social worker. Further, for HIV counselors, family planning counselors, the category for community care and behavioral health science other professional will be chosen. Mental health support workers also same. So once you have chosen these, my dear friends, you need to move further and you have to give certain important information. Here, once you have done this, you have enrolled, ID will be generated. That means login credentials are done and basic demographic details have been given. So now you need to move further. Here, the personal details, qualification details, work details, and you are going to preview the profile before you submit. The first one is very essential is personal details. How you will be called, whether it is Mr., Mrs., if you are done PhD, doctor. Name of how it should be displayed in public, spouse name, parents name, nationality, place of birth, language spoken will be taken here. After that, you will be address as per the Aadhaar card will be given, and if you tick here yes, the communication and also the Aadhaar address remains same, you need not worry. Suppose communicating address is different, then you need to provide one more address where they will communicate with you. Further, now you are going to qualification details. Here you will be entering under which allied healthcare professional. If you are a psychologist or a social worker, then you will be entering the seventh category. After entering that, you will be uploading 10th standard, 12th standard, marks card will be uploaded here. Later, you will be uploading degree, post-graduation, PhD. Those information will be given here. That is basic professional qualification will be uploaded. Further, current work details, internship, and past experience letters will be uploaded here. So my dear friends, so before you start the enrollment, keep your internship certificate, work experience certificate, current work experience certificate, which are issued by the head of your institution on their letterhead. Please keep this ready. Along with that letterhead should have clearly the communication details, whom to contact if the ministry want to contact. Further, if you want to provide the clinical working address, that can be given here, it is an optional. And finally, now you are going to verify and submit. Once you submit, you will get the acknowledgement, yes, you have submitted your registration. Further, this is about the enrollment of the professional. However, this portal also gives enrollment of the institution. For example, if you are studied in certain college or institution, you can ask your institution to register here. That is Allied and Healthcare Institution and College Enrollment. Again, this is not a registration, it is an enrollment, so that this Government of India comes to know which are those institutions which are providing allied and healthcare courses. Please scan this QR code for the purpose of visiting this website. Who can enroll? Here, any institutions or the college who are running allied and healthcare profession courses need to be registered, which are running with these 10 categories which are mentioned under the National Commission for Allied and Healthcare Professional Act 2021. At this point of time, only 53 colleges and 79 programs have been enrolled. That means, my dear friends, many of the colleges and the institution do not know the enrollment is started. If you have any doubt or problem, or if you have any grievance, please use this grievance website, or else you can call the toll-free number which is 24/7. And this is also available on the website. So my dear friends, either you can email or 24/7 you can make a call and you can write the grievance. This is where the grievance is there. You can look into the frequently asked questions, register your grievance. You can track the grievance application, where is it? And the turnaround is usually 3 to 4 weeks. That's what the Ayushman Bharat Digital Mission grievance portal says. That is, within 4 weeks, they will resolve your questions or the problems. But however, please go through this portal for your any questions. Not only that, the Government of India has also started ABA app, which is there both in Google Play and App Store. If you want to download, you can keep your health records. If you are a professional, you can register here. And every 3 to 6 months, they are upgrading this app. So my dear friends, under Ministry of Health and Family Welfare, this is a significant step taken to register all healthcare professionals, institutions, so that under Ayushman Bharat, service provider, service users, under Ayushman Bharat Cloud, they can be kept. To conclude, my dear friends, every person working and has a qualification as recognized under the National Commission for Allied Healthcare Profession Act 2021 needs to register here. At present, the central government has made it free. Otherwise, it is 2,000 rupees. Who knows? The state may increase the cost. So if you are eligible, please do enroll. Here, the enrollment of both professionals and the institutions are already started. This portal is very comprehensive, easy to use, 24/7 grievance redressal phone call is there. You can register your grievances and track your grievances. This is an initiative of Government of India under Ministry of Health and Family Welfare, National Health Authority, and National Commission for Allied and Healthcare Professionals. Thank you very much for giving your valuable time. Stay safe and enroll yourself under the National Commission for Allied and Healthcare Professionals.